Next up on my video series of Adventurous medical jobs is talking about civilian flight positions on fixed wings, so airplanes. I've already previously talked about air rescue and helicopter EMS. Hi, my name is Heather. I'm a 20-year first responder turned holistic health nurse coach, and I'm here to inspire and support you to take better care of yourself. I'm also leading the way on a campaign, #sabbaticals for first responders. For context, I have 11 years of flying both helicopter EMS and on fixed wings, including single prop, dual prop, and Lear jets. Oh, and with a government mission, I've also flown in 737s to evac patients. Being a flight nurse, flight medic, possibly EMT, NP, PA, or even a physician on a fixed wing program can be very rewarding for a lot of people. So why might someone not want to be in a helicopter EMS system or just not be able to? One thing I did not mention in my previous video, for working in helicopter EMS, body weight is a significant factor. Some programs might have 220 pounds, some places might have 200 pounds. Either way, there is a limit to how much lift a helicopter can produce in given temperatures at given altitudes or elevations of where they're lifting from. So maybe despite your best efforts, you haven't been able to get under whatever that program's weight limit is. Fixed wing usually has a lot more wiggle room here. Generally speaking, fixed wing aircraft programs are not part of an EMS system. They, for obvious reasons, usually can't land at the scene of an accident or incident unless that happens to be at an airport or very nearby. There are, of course, exceptions to this, as some fixed wing programs operate on island groups where that is your only way of getting transported from an accident scene, usually in conjunction with some ground provider, rendezvousing at an airport and flying back to a different island group. But generally speaking, this is not the most efficient way to get from the scene of an accident to a hospital. As a result, generally speaking, mission of fixed wing aircraft in the medical transport industry is for doing interfacility transfers from, generally speaking, smaller or more rural or less specialized hospitals coming into major cities that have specialty care, whether that's trauma, pediatrics, cardiac, organ transplants, or whatever. The size of your aircraft, whether it's a prop jet or Lear jet or something else, will kind of dictate the breadth of your area of coverage. The primary program for which I was a part, based in Northern California, we would take fixed wing calls all over California. This way, Bobbies, come on, let's go. All over California, Oregon, Washington, Arizona, Nevada. So basically like the Western United States. As you can imagine, even in those regional calls, your transport time, therefore your patient contact time, is going to be much greater. At least with the company where I worked, we responded to the small hospital via ground transport, took them within an ambulance, provided care in the ambulance on the ground transport back to the airport, fly from airport to airport, rendezvous with another ground transport, and we're not handing off care there. We're actually taking them all the way to the bedside of the receiving hospital. So generally speaking, this kind of a position would be looking for somebody with critical care experience, whether that's a flight nurse, you're looking for having ICU, critical care experience, trauma, surgical ICUs, neuro ICUs, cardiac, CV, cardiovascular ICUs, etc. And for paramedic, having critical care transport experience and certifications would certainly enhance your application for those. The other aspect of fixed wing flight medicine that you could consider getting into would be longer transports, like full international flights, repatriating citizens from the Hawaiian Islands back to stateside, or from other countries, bringing them back, to the U.S. And there are several organizations, and I haven't actually had these positions, but my understanding is you can do different arrangements like week on, week off, you're on call, you could go anywhere, at a moment's notice, you have to live near a major airport, all sorts of cool stuff. This is my 12th video on adventurous medical careers, and like I said at the beginning, there's a video on air rescue and another video on HEMS, helicopter EMS. If you have any specific questions on any of the content that I've covered in these videos, or pretty much any video, please feel free to put a comment here, ask the question, or DM me. I look at and read and do my best to respond to all of them, and I'm just here to support you in your career exploration, try to keep people in the profession being excited about coming to work for as long as possible. Otherwise, follow me, like, comment, share, come back for more. Thanks, y'all, and be well.